What if the real reason your blood pressure refuses to come down has nothing to do with salt, stress, or even your medication? What if a supplement millions of people take every day is being used the wrong way and that single mistake is silently keeping your blood pressure high? Today, I'll show you 5 critical vitamin D mistakes that can add 15 to 20 points to your blood pressure, and how fixing them could change everything. Welcome to my YouTube channel. I'm Dr. Robert. After years of working with heart and blood pressure patients, I've seen something surprising again and again. People follow their prescriptions perfectly, they take supplements daily, and yet, their blood pressure stays stubbornly high. Recent research has finally explained why, and vitamin D is at the center of it. By the end of this video, you'll know the 5 biggest vitamin D mistakes people make, why one mistake is more dangerous than all the others combined, and the exact protocol to take vitamin D the right way. Starting tonight, let's begin with mistake number 5. Mistake number 5. Taking vitamin D without vitamin K2. Vitamin D helps your body absorb calcium. That's good, but only if calcium goes to the right place. Without vitamin K2, calcium can settle where it doesn't belong, inside your arteries. I worked with a 70-year-old man whose vitamin D levels looked normal on paper, but over time, his arteries became stiff and calcified, and his blood pressure slowly climbed. The missing piece: vitamin K2. K2 activates proteins that push calcium into bones and keep it out of blood vessels. Without it, vitamin D can actually worsen arterial stiffness. What to do? Always pair vitamin D3 with K2-MK7 for my ideal dose. 100-200 micrograms daily. Take them together. At the same time, this step alone improves artery flexibility and blood pressure response. Mistake number 4. Taking vitamin D without the right fat. Vitamin D is fat soluble. No fat equals poor absorption. Many people swallow their vitamin D with coffee, toast, or water. That means most of it passes straight through unused. But here's what newer research shows: not all fats work the same. Vitamin D absorbs best with omega-3 fats, not vegetable oils. One patient took vitamin D for years with no improvement. We changed just one thing, adding omega-3 fat, and within months, her vitamin D levels and blood pressure both improved. Best options: 1 tablespoon fish oil or cod liver oil, a small handful of walnuts, flaxseed oil. If fish oil isn't tolerated, this can double absorption. Mistake number 3. Using vitamin D2 instead of D3. This one surprises many people. Prescription vitamin D is often D2, not D3. Vitamin D2 is synthetic, leaves the body faster, activates receptors less effectively. Vitamin D3 is the natural form your skin makes from sunlight. Studies show D3 is far more effective for heart and blood pressure benefits. I've seen patients with normal vitamin D levels on D2 but no blood pressure improvement at all. Once switched to D3, results changed within months. What to check? Bottle should say cholecalciferol D3. Avoid ergocalciferol D2. D3 is the form you want, no debate here. Mistake number 2. Taking too low a dose. Most doctors prescribe vitamin D for bone health, not heart health, but cardiovascular benefits require higher blood levels. Bone health range: 30-40. Heart protection range: 50-70 ing normal. Many people stop at normal and never reach optimal. In practice, most adults need 0.0006000 IU of D3 daily, sometimes more, depending on body size and absorption. Once levels cross into the 50-70 range, blood pressure reductions become noticeable. Testing after 3 months is essential. Mistake number 1. Most important: taking vitamin D in the morning. This is the mistake that cancels everything else. Vitamin D interacts with your circadian rhythm. Taken in the morning, it signals alertness, stress hormones, sympathetic nervous system activation that keeps blood pressure elevated, especially at night. Blood pressure should drop 10-20 during sleep. This nighttime dip protects your heart. Morning vitamin D disrupts that dip. When patients switch to nighttime dosing, results can be dramatic. Same dose, same supplement, only the timing changes. Nighttime vitamin D supports proper blood pressure dipping, arterial repair, cardiovascular recovery during sleep. This single change can mean the difference between no improvement and medication level results. The gold standard vitamin D protocol: here's the exact system that works best. Form: vitamin D3 only, dose 400-600 IU daily. Cofactors: K2-MK7, 100,200 mg fat, omega-3 source fish oil or equivalent timing, at night before bed testing, check levels after 3 months target level, 50-70 ing normal monitoring, track blood pressure regularly medications, adjust only with your doctor. This approach aligns vitamin D with your body's natural rhythm instead of fighting it. Safety notes. Vitamin D is safe for most people at these doses. However, kidney disease, certain inflammatory conditions, blood thinners due to K2. Always discuss changes with your physician. If vitamin D hasn't helped your blood pressure, it's likely not because it doesn't work but because it's being used incorrectly. Fix the timing, fix the form, fix the dose, fix the absorption. If this video helped you, watch the next video on your screen, where I explain another simple habit that dramatically improves heart health. Subscribe for more evidence-based strategies that reduce reliance on medication and put you back in control of your health, and leave a comment were you taking vitamin D in the morning.